let's get started. Awesome, because everybody's been here for a little while now. Thanks everybody for joining in. There'll be people that will just, I assume, will just join in throughout the webinar, and that's all good. And if you have to leave, that's all good too. So thanks everybody for joining in tonight. We will start off tonight by introducing Tūranga Barclay Kerr, who is a member of our Waka Ama New Zealand board, and also long-time paddler and Te Tuki Voyaging Trust member and organiser extraordinaire. So without further ado, Tūranga.
Kia ora whānau, kia ora mai tātou, I runga anō I te kaupapa o tēnei ahiahi. I tika ana me mihi atu ki a rātou mā kua rere ki tua o te Aotearoa, I whakaaro nui ana ki a Kawhoa, me tōna whānau ki tāna hoa Kathy, e noho pani ana I tēnei wā. Ki ngā whānau puta no I te motu, e tangi ana mō a mātou whānau, mō ngā uri kua huri atu ki tua o te pō. Ki a rātou haere, ki a tātou e tau nei, I runga anō I te karanga me te kaupapa o tēnei ahiahi, ki a koutou ngā toa o tēnei ao, e whakamārama ana I ngā āhuatanga o tēnei ao huruhuri e noho nei tātou I tēnei wā, tēnei ka tika me mihi atu ki a koutou, me mihi atu hoki ki a koe Lara, me Waka Ama, I whakatūwhera I tēnei kuaha ki o tātou whānau, I tēnei ahiahi, kia whai whakaaro, kia whai kōrero mō ngā āhuatanga o tēnei take nui, e pā nei ki a tātou katoa. Kia timata ake tā tātou pō ki te karakia, ka tahi ka tuku, ka whakahoki te rākau ki a Lara, me a tātou manuwhiri, hei arataki a mātou I tēnei pō. Kia inoi tātou. Tuputupu ake te maurika tū, tuputupu ake te maurika horo nui, horo rangi, ko tangaroa tihihi moana, ko tangaroa tihihi rangi ka tū kapa, ko māpuna uta, ko māpuna taiki, hai hoi rangi ka pauria I a te wā, tūturu ofeti whakamaua kia tīna, hui e, tā iki e. Kia ora tātou.
Kia ora Tūranga, thank you for that welcome. And yeah, we wanted to mention tonight, especially the loss of Kawhoa, paddler from the Portage Crossing Canoe Club, and our aroha goes out to his whānau, Kathy, and all of the Portage Crossing Canoe Club tonight. We know that they are very saddened by the loss of their awesome coach and legendary paddler. So our thoughts are with all of them tonight as we get started. I'd like to start off tonight just by first of all thanking our special guests here this evening, three amazingly talented and knowledgeable doctors who've given up their time to help us with this kaupapa. And I'll ask them to introduce themselves if that's okay, but I just wanted to mention that you know, Matire and Jamie Lee, obviously part of our Waka Ama Whānau for a very long time, and I've had the pleasure of paddling with them a lot and in some amazing places around the world, and what happens on tour stays on tour, all of that. So we won't go into that tonight, but and Anthony Jordan, who has never paddled, but we won't hold that against him. So if you'd like to start off, Matire.
Oh, kia ora tātou, and thanks for the invitation to come and speak tonight, Lara, and to everybody who's joined in tonight. And though I can't see you all, I can feel the aroha and the wairua or through the Zoom or the Zui tonight. So wonderful. Nō te taitoke rewa hau, ko Ngāpuhi te iwi. Engari e noho anō ki tamaki ki te tonga, e noa nei. Yeah, my name is Matire. I live in South Auckland. I work as a GP at Papakura Marae Health Clinic part-time and as an associate professor at the medical school in Grafton across from the hospital. Very missing Waka at the moment. Has been very busy these last 18 months with COVID mahi. And yeah, as Lara said, paddled with lots of clubs across the motu, but really missing it at the moment, missing the camaraderie and the whakawhanaungatanga of waka. My interest in the vaccine, I was on the Science Technical Advisory Group as the Māori representative to ensure that any decisions around the vaccine that were purchased by the government had equity in Māori and Te Tiriti at its heart. And so I was there taking our voice to that space and spent a lot of time with some very brainy scientists as we looked at hundreds and hundreds of pages of information about what would be best for Aotearoa. And so feel that we've made the right decision with this Pfizer, but also understand the concerns and anxieties that people have had with something that's new and that was brought in, the technology was brought in very quickly. So really here to support and encourage people to take this evidence-based, excellent intervention up, but equally just want to address those queries and concerns tonight. So yeah, looking forward to having a good conversation. Kia ora.
Thanks, Matire. Who's next? Jamie Lee?
Kia ora te whānau, ko Jamie Lee Rahiri a hau, he uri a hau no Ngāti Porou, te ati haunui a pāparingi ni Ngāti Whātoki Kaipara. I noho ana mātou ko te whānau ki Tāmaki Makaurau, kei te honua hau ki te karapu Waka Ama o Taniwha, ki te raki pai whenua. E tautoko ana hau te kōrero a tūranga. Tēnei o mātou mihi aroha ki a koutou te whānau pani o Kawhua. E mōhio ana au tēnei tāne tino tūmaia. Nō reira, tēnā koutou, tēnā koutou, tēnā koutou katoa. So I'm Jamie Lee. I am honestly probably the sprout just coming above the ground amongst these two amazing tōtara, Matire and Ants. But I definitely didn't hesitate to come and tautoko this kaupapa. I like Matire miss Waka Ama so much. There's just no time in the day to do it anymore for us. And as I sit here, my parents, Ben and Sugar, are hiding in the room with our tamariki. So it's a whānau affair here. So just here to be a part of the safe space and be as supportive as we can as a whānau. Ngā mihi.
Kia ora, Jamie Lee. Over to you, Anthony.
Kia ora whānau, ko Anthony tēnei, ko Ngāti Waio te iwi, and my day job is, prior to COVID, I was a clinical immunologist. I still am, but at the moment, I'm the clinical director for the NRHCC, which is the organisation that oversees the vaccine rollout for the 3 metro Dhbs in Auckland and also supporting Northland. So I grew up in Te Taitokiro in Whangarei, so I have a special place in my heart for making sure that Northland gets its fair share of protection. And just like Matire, my role has been to ensure equity in the delivery program. So where Matire worked really hard to ensure that we got the best product, my job was to ensure the best delivery system. And so every day I go to work and continue to fight for equity for Māori. So I'm really proud to be here to support this kaupapa that we're embarking upon today to answer questions. And I must admit, like, there's some really well thought through questions that people have. So thanks to everyone for putting really good thought into asking these questions. And I just want to say that I really appreciate all that.
Awesome. Yeah, amazing. We're really blessed to have you all here tonight. So thank you. Ko Lara Collins tōku ingoa, ko au te kai whakahaere o ngā kaihoi o Aotearoa, Waka Ama New Zealand. I'm the CEO of Waka Ama New Zealand. For those of you who haven't met me before, who are on the online tonight, I know that we had about 65 registrations from our Waka Ama community, and then there are also a lot of people that are joining in tonight from other sports that have that are just keen to listen and learn a bit more about the vaccine and this kaupapa and how we deal with COVID moving forward generally in the sporting community. So welcome to all of those people that are joined in tonight as well. Our Waka Ama community is inclusive and embracing all of you, and you're welcome to come along for a paddle anytime you like. As Anthony mentioned, we have received quite a lot of questions through the registration process. We've received well over 60 questions, and our doctors have actually taken the time to go through the questions and sort them into categories, and where there are questions that are the same or around the same subject, we've grouped those questions together so that we can handle them easier tonight. So you may hear your question word for word, or it may be slightly mashed up with somebody else's question, but we hope you get the same answer. We've got our media Mita. You can see the Waka Ama New Zealand screen there. That's our media. She's running shotgun behind the scenes, answering any chat questions that you have, and I think she's posting some information if you have any technical difficulties or want to get in touch with us. There's some information in the chat for you there. We're not having a live discussion tonight, so there isn't an opportunity to ask more questions, but I think we've got heaps on our list to get through. So if there's anything that wasn't answered tonight and is a really burning issue for you, please do get in touch with us, and I'm sure that our doctors will be happy to answer those questions after the webinar via email. And so we will get started, because the most important thing is answering all of these questions that we had. So I'm going to ask the questions, and I'll direct them to one of our doctors, and then we'll just go from there and see how we go. So we'll get started with the first one, which is for Anthony, and that is, Anthony, what is in the vaccine and how effective is it?
So the Pfizer vaccine is an mRNA vaccine. So within that is a set of instructions that tells your body what COVID is. So it allows us to remember through our immune system what COVID looks like. The important thing to remember is it doesn't actually contain the virus, and it can't do anything to your DNA. Those are the two things that people really worry about. It could interfere with my DNA, or it could give me COVID. It's not designed to do that. mRNA isn't something that lasts a long time, so it needs to be surrounded by a protective layer, and that has the coating that goes around that mRNA, and that allows it to move from the muscle to your lymph nodes, where it educates the immune system. And that's just contained, again, in some fluid that's designed like an isotonic fluid that allows it to move through the tissues without sort of being destroyed. So those are the three main components that are contained within this vaccine. Now, effectiveness is the second bit. So when we study the vaccine, we have to have lots of different things that we look at. So we look at first, does it help prevent transmission? Does it stop people getting really sick? And does it stop people going to hospital? And does it stop people dying? And so let's start at the worst thing. It's very effective at stopping people dying. It's got a 95% success rate after 2 doses at about day 7 to day 14 after that second dose. In terms of preventing people getting severely ill and hospitalized, again, it's around 92 to 95%. And that's been studied through a couple of different studies. The very original study, then the Israeli study, and then studies from other parts of the world when they just looked at populations to say, hey, what happens in a study? Does that actually happen in the real world? So we should be really reassured it's been answered in the real world as well as in really controlled studies as well. Then we drop down to the next level. Can it sort of prevent people just getting a mild to moderate illness? It does. It can make some people actually go from having some symptoms to nothing at all. And so you change an illness that is a disease into something that just no one recognizes because it's called being asymptomatic. So you just don't know you carry it. And then the last bit is the bit that I think people often have most questions about is, okay, if I get vaccinated, can I still catch it and can I still pass it on? Now, the Pfizer vaccine was more effective at preventing that passing on activity with the original virus, but now we look at Delta. Delta is just much more difficult. It's much more easily transmitted. And I kind of liken it that the virus gets into our body, but the vaccine stops it having bad effects on our body. So a vaccine doesn't kind of provide a force field around us, but what we have is we have other measures like masking, hand hygiene, distancing. So I like to think as vaccine as part of a whole system of protection. So it's really important to sort of say it's an and thing. It's not an and or, you know, do one and not the other. So we have to use all of the strategies we have.
Right, and so just back with, so it's on that same question. So does being fully vaccinated protect other people?
The concept of protecting other people through being vaccinated is kind of this idea of having many roadblocks. So if lots of people can stop the transmission of the virus, yes, it can. But because it's not as effective at doing that, you need really high rates. So when we were talking in the beginning, we were like, maybe about 75 to 80%. And now we go up to 90 to 95 because the virus has changed. So people should see that not as us being wrong, but actually viruses adapt. They get better at doing some things. So this is the natural part of what viruses do. They adapt, they change, they can get bad and not infect people, but they can also get better at infecting people. So this is why we need to constantly review the evidence, update our recommendations, tell people what it's about. And that's a really important part about us as a medical profession, being evidence-based, being scientific, and making sure that we share that information. So yes, it can work, but it just doesn't work as well. So that concept of herd immunity is something that gets harder as the virus gets better.
Right, awesome, thank you. Next question for you, Matire. What is the risk of getting COVID if you don't have the vaccine?
So if you don't have the vaccine, so I think as Anthony said, it does reduce your risk of getting COVID, but it doesn't completely stop it. As he said, it's not a force field, it's just part of a package that's going to prevent you from getting COVID. But what it does do is reduce the likelihood of that COVID getting away from you, becoming more serious. It prevents the progression of COVID to be a longer disease. So we know now that increasingly there are at least 10% of people are going to get long COVID and have long-standing symptoms, which tend to affect the lungs. So they tend to become more breathless, and their heart. So they find that they become short of puff much easier as well. So we know that it reduces their risk for having long COVID, but most importantly, reduces the risk from dying. So as Anthony said, lots of studies now showing that. The latest to come out of France in the last couple of days looked at 22 million people who'd had the 2 doses of the COVID vaccine, and found that those who'd had vaccine, 90% less likely to die from COVID or be hospitalised from it. So we know it's effective in terms of preventing serious outcomes from COVID. In New Zealand, if you look at just this Delta infection that we've had this year, and we look at all of the people who've been hospitalised with that, 90% of them were not vaccinated and only 2% were fully vaccinated. So really important that we try and reduce this, not only for the personal, the individual, but also to reduce the burden on our health system. Because as we fill up more beds in the hospitals and our staff are dedicated to looking after more and more COVID cases, it means that we then can't focus on other emergencies or cancer care and looking after our children and things like that. So that's another reason that we're trying to promote this.
Awesome. And can unvaccinated people spread COVID-19 to vaccinated people? That one's for you, Matire.
I don't remember this one on my list, but so what was the question again? Sorry, can
unvaccinated people spread COVID-19 to vaccinated people?
So COVID, as Anthony said, if you're vaccinated, you're still at risk of getting the infection. We think, especially with the Delta, as he said, because it's just there's so much of the virus in the respiratory tract, there's just so much of it then that gets into the air as we're breathing or coughing or singing, you know, anything that's going to put breath or air into the air and then is breathed by others. So certainly people are at risk. The vaccine was developed for the Alpha variant. We now have the Delta variant. And I like an analogy somebody used that I read in the last couple of days, and they said it's like you're building a virus for a black cat. And so when you do building a vaccine for a black cat. So when you first give the vaccine, they see a black cat and they can stop it immediately, they get rid of it. Delta now is probably an orange cat. And so the vaccine goes, oh, it looks like a cat. Is it a cat? And in that time, it's the virus can get into the body. And then it sort of goes, oh yeah, it's still a cat anyway. It doesn't matter. Let's just get rid of it anyway. So it's that time, that lag in the body responding to this variant of the Delta virus when the infection can get into somebody who might already be vaccinated. But we still know it's not going to be as serious as if they weren't not vaccinated.
Right, so definitely difference between severity for vaccinated and unvaccinated.
Definitely.
Awesome, thanks. Over to you, Jamie Lee. Are you able to share with us the current stats in New Zealand, vaccination stats, COVID stats that you have?
Yeah, kia ora. So Matire kind of mentioned it earlier before, but there's a beautiful graphic diagram that I could share, but I won't, just in case we disconnect. But what we know from about 2 days ago, so October the 11th, is that when we had the rates of the total population, we knew that about 48% of us were fully vaccinated and 21% had, one shot. And then of the cases in total, so everyone that's ever had COVID in this outbreak, about 1,622-ish, we know, as Matire said, that just under 90% were not vaccinated or hadn't had one shot at all. About just under 10% had one shot, and 4% over the whole group of everybody that's had COVID were double vaccinated, had both shots. And I think the other important part of the stats that everyone wants to know is about the hospitalization rates. So we know 2 days ago that 91% of all those cases, which was around, so in total 158, they were not vaccinated. So I think it's always important to break those down, the total population that's vaccinated, those of the cases who were vaccinated and those who were hospitalized, because that's definitely been a point of discussion. And a lot of the kaupapa will come up later in the questions around, well, if most of them have recovered and most of them were unvaccinated, why then do we need the vaccination? But we'll cover that further down the track.
Thanks, Jamie Lee. Next one's for you, Anthony. How will the Pfizer vaccine affect us long term?
Well, hopefully the main thing it does is make your immune system remember COVID and protect you for a long time. I think the question's not designed for me to sort of plug that. It's what are the side effects of it? And most of the side effects are pretty short-lived, to be honest. Muscle aches, pain at the injection site, feeling a bit tired the next day. When I got my second dose, I woke up at 2 a.m. thinking, oh, this must be like what morning sickness is. And I was like, well, I'm definitely not pregnant. It might be the vaccine. So you can get side effects, but they're short-lived. The thing that people always look at, and I remember looking through the questions, people were going to different websites to look for serious side effects, like inflammation of the heart, is you always need to think about rare side effects in the context of what is the disease doing? So when you think about inflammation of the heart, it's like 3 in 1 million. So it is going to be very few people. If you take COVID, it's 4 to 5 times that rate affecting the heart, okay? And that's when we've looked. So we actively look when we vaccinate people for side effects. We don't always do the same thing when people get COVID, for example. So we're mandated to look for side effects as part of the surveillance program of any medication that we use here in New Zealand. And people should be reassured by that, that we are looking for side effects. But always think about the other side of the coin, is what would it mean if I had COVID and what would that do to me? And so Matire has already talked about the fact that long COVID is not something we ever want to get. And 10% exceeds the rate of any side effect of grave concern that is, talked about in over 350 million doses delivered worldwide. So it is a huge amount of data that we go through to be reassured that we know exactly what's going on.
Right, that's awesome statistics. Anthony, how long does the second jab cover us for?
Good question. And I think someone else in the questions referred to the Israeli data saying that they're going for 3rd and 4th booster doses, and the data from their studies looked at blood levels in terms of antibodies that are still circulating, and they were saying maybe 6 months, maybe 9 months, but it may actually be a lot longer, because what we always know about any sort of vaccination is antibodies are the first signal that happen in a cascade of what your immune system does. And actually, for a lot of vaccine preventable diseases, antibodies drop down to a very low level, but they still protect us from the disease. So just be really mindful when you're looking at that data saying, do I need one at 6 or 9 months, that actually the protection of the vaccine may be a lot longer. Do I think we're not going to need boosters? I think we will need boosters because we will want a vaccine that's better. So we will want something that does that transmission work a bit better, works better against Delta or another strain that may come. So I think we should look forward to a booster, but hopefully it'll be something that offers us a bit of different protection as well.
Awesome. Matire, can the vaccine lessen the effect of or have an effect on regular medications such as Thyroxine or Warfarin, or are there other medicine interactions that you know of?
Ka pai you with your medical words there. Yeah. When they were developing the vaccine, they knew that it was really important that it was going to be effective for people with long-term conditions, because they were the people most at risk for dying from COVID. So they looked at interactions with all sorts of medication, including Thyroxine and Warfarin, and being able to show that they do not interact and they do not reduce the effectiveness of those medications. The main risk with Warfarin is that it's a blood thinner, which means that you're more at risk of bleeding were you to have a puncture like you do with an injection with a vaccine. And so we do ask people to check their INR, which is their blood thinning level, prior to getting the vaccination, and ensuring that it's within their therapeutic range, so people should know what that level is going to be. If it's higher than that, you should avoid the vaccine until it's come back to that therapeutic level. But if it is safe, then you should let your vaccinator know that you are on a blood thinning agent, so that they will ensure that they apply good pressure after the injection and make sure that it doesn't bleed. And that you should monitor the site yourself for oozing or excessive bruising. And if that were to happen, go and seek medical attention. Yeah.
Yeah, I guess that what you were just talking about there is part of the medical checklist pre and post having the vaccination, right? Yeah,
so we do it when you turn up for your vaccine. They'll ask you a lot of questions. I think for those people who are concerned or feel that they might have more complex medical issues, it would be worthwhile going and talking with your GP first, because they do have a more substantive list that they can go through and check off with you and just allay any fears or concerns that you might have about one of the medicines you're on, or one of the health conditions you have. And as a GP, that's what I'm seeing mostly, is people, when they want to talk to me about the vaccine, it is around, is it okay with this medicine? Is it okay with this health condition? We talk it through. Once they feel that they've had all their concerns and questions addressed, they're happy to go and have the vaccine and don't have any problems.
Awesome, thank you, Matire. Jamie Lee, why is there a 3 to 6 week gap between the doses? And is it more effective to do 3 weeks or 6 weeks?
I remember when the government made this announcement mid-August, when they said, oh, so originally they tell us, you know, oh, 3 weeks, and then you do your second dose. And then I think right at the time they made the announcement, I was due for my 3-week second vaccination. So I totally tautoko that pātai, because I was thinking to myself, I could wait 6 weeks, but I had to work in the hospital, so I went and had it at 3 weeks. What is important to remember in that announcement, which is available online, is that it was largely a move of practicality. So at the time it was about let's move it from 3 to 6 weeks so we can get more people to have their first shot. So the focus shifted to let's just get as much of the vaccine out as possible, because remembering there was a shortage of the vaccines at that time. And so now what the ministry is saying on their website is that 3 to 6 weeks is fine. So the evidence tells us very clearly that whether you have it at 3 or 6 weeks doesn't mean that there's a huge difference, if anything at all. So kaua ia wā wanga, I totally understand that anxiety.
Right. Awesome, thanks, Jamie Lee. Here's the one you were referring to earlier, Anthony, regarding Israel and Ireland. The question is that there has been an increase of COVID infections in places like Israel and Ireland, and the majority of these populations were vaccinated. Will we suffer the same fate? Will we need boosters going forward? Can we expect evolving future vaccine rollouts? And is that safe? I think you may have answered some of those, but we touch on it again for some people who might not have heard.
So many questions. I'll just talk about Israel and Ireland, because they're often two countries that are often referred to. Israel was very early on in the vaccination program, so they were part of a big study, so they were vaccinated very early. They had good results from the vaccine, and although testing rates for positivity for COVID have gone up in Israel, the death rate and the hospitalization rate has still remained low. So you've got to put it into context about what you're measuring. The other bit that I'd say about Ireland is Ireland was in a completely different situation. They had a lot of COVID spreading through their community as they were vaccinating. So a lot of people got COVID. But again, even in that population, even though the numbers of tests turning positive, the Irish medical system is still coping really well, because actually the hospitalization and severe illness rates are down. So you've got to see probably Ireland as a joint project of lots of people had COVID, people got vaccinated. Israel's slightly different, is that they had a very early vaccination program, but they're still seeing the benefits of it later down the track. And we've kind of covered off the booster situation anyway around, yes, we will probably need a booster, but hopefully it'll be something that's more refined to give us better protection. Yeah. Now, was there anything I missed?
No, I think that's pretty much it. The booster covers the black cats or the orange cats.
All cats, hopefully.
Yeah. We're back to you, Matire. If I've already tested positive for COVID, why would I need to be vaccinated?
So unfortunately, we know that you can become infected with COVID more than once. So there have been cases reported of people who had COVID, completely recovered, and then became infected again. So we know that getting infected with COVID does mount an immune response, but we can't confidently say how well that response is. We do seem to see that the response is, and antibody numbers reflect this in blood tests, is less when you have a more mild disease. And that would be expected, because when you've got severe disease, your body's going to be going full on and put out heaps of antibodies to try and fight that. So, and prevent you from it happening again. So at the moment, we can't confidently say how well you will be protected if you've had the COVID infection, as opposed to knowing and being more confident that we have a better understanding of the reliability and the immune response that you will have when you have the vaccine, if that makes sense. So we can't say having an infection is going to be as good as having the vaccine. But I think too, you wouldn't want to rely on sort of a natural immunity, because you're at risk of getting severe disease and the long-term implications or complications of long COVID. They're not things that we would want people to do. So currently, until we get more information, New Zealand is recommending that people who have had COVID do go on to have the vaccine. We ask that they wait until they're fully recovered, but up to about 3 months is the maximum time, is my understanding, once they've recovered from COVID, before they go on to have the vaccine to protect them and ensure they've got the best protection for the future.
Right. And what about other viruses that are currently more contagious or deadly than COVID, like HIV or hepatitis?
Yeah, so in terms of contagiousness, the one that's probably most like the Delta variant anyway is measles, and because it's airborne. But we are protected here in New Zealand from that contagious illness because of herd immunity. So over 90, almost 95% of New Zealanders are protected against measles because they've either had the vaccine or may have had it as a child and not been aware of it. In terms of HIV and hepatitis, these are not as contagious because they tend to be, well, they are transmitted through bodily fluids. They're not present in the air, they're not breathed in. So that you wouldn't think of them as being contagious, but you're right, they are more deadly. So if you were to look at total numbers, we've had COVID, maybe 2 years, I suppose, at the most. We're looking at around, what's that?
Feels like forever.
Yeah. We've had about 200 million cases, I think, in that short time, and 4 million deaths. So that kind of goes to show how contagious it is. When you look at something like HIV, which has been around maybe 40 years, the numbers are 80 million. So not as much as 200 million in 2 years, but the deaths from HIV are around 37 million. So 80 million cases, 37 million people have died from it. The good thing with HIV is we do have treatments now. So people who are on treatment do carry on and have a life expectancy as a normal person would. But we also know that if you're not on that treatment, 95% of those people will die from HIV. So it is a deadly disease when compared to COVID anyway. Sorry, excuse me. The stats for hepatitis are also pretty dire in New Zealand, and we have high rates of hepatitis. We have high rates of cancer as a result of having hepatitis infection. But that's one of the reasons why we've mandated hepatitis B infections for all health workers, to ensure that we're not passing that infection on to our patients that we care for, and equally that patients are not going to make us unwell when we're treating them, or as Jamie Lee will be doing surgery on them. So, you know, we're used to having mandated vaccines because we know the importance of protecting not only ourselves, but the people that we work with.
Awesome. Kia ora Matire. Jamie Lee, how do we receive a vaccination card to prove that we've been vaccinated when we weren't given one at the drive-through vaccination park?
The first thing about that is if you haven't got a card, that's not unusual. So some vaccination sites aren't actually giving out the little purple cards. And the main reason for that is they're trying to remain contactless. But the other thing that I actually didn't know was that the actual card itself isn't a formal ID of that you've been vaccinated. So you would have seen they've brought in, I think online you can actually apply to have a certificate. The thing about that is it's pretty limiting. So you can go online and you request it and you can receive it by mail or by email, but that means you have to have access to, both of those things, which people take for granted and assume we all do. They're not bringing that out until I think next month. So if you're ever unsure though, whether you've been vaccinated or not is on your medical record. So you can always see your GP or phone the clinic, the nurse to print some kind of proof of that out for you. Yeah, they're my
awesome. Thank you. And staying with you, Jamie Lee, can I still get vaccinated while I have a cold, an injury or a stomach bug?
Short answer is no. I think if you're ever unwell or you're doubtful, just can it and reschedule it. If you've got cold symptoms, get a test.
Perfect. Great. Awesome, team. We're doing well. Our next section of questions are really geared around the side effects of Pfizer, and we're back to you, Anthony. How do we know? How do we know it's safe? Long-term studies haven't been conducted. Pregnancy, fertility, and so on won't be known until our kids are possibly facing the consequences of what seems to be like a rushed strategy. Yet survival is important, but when does the degree of possible suffering get considered? It's a heavy one.
Yeah, I feel like I'm going to start at the end, because actually survival is probably the most important thing, because having someone die is the worst form of suffering. And that last part of that question was about mental health wellness, and actually losing a loved one or living with a long-term condition causes some of the worst mental anguish that we'll ever experience in our life. And we all know that. We've all experienced that at some point in our lives. I'll skip back to the front end of the question and say, how do we know it's rushed? Well, it's not rushed, because actually what we do when we study medicines is we look at the condition we're treating, the number of people that have it, and if you've got lots of people and lots of disease, it allows us to shorten the period of time that we can generate really good quality data. So if we have administered 350 million doses of the Pfizer vaccine, we have a lot of good information about what it does, because we'll see rare side effects. And actually, like I said before, we're actually continuously looking at it. We are required to monitor it over and over again. We have to look at it. We have to make sure that there's no links between what people tell us. 90 people on average die in New Zealand every day. The rates of vaccination intersect with that. And so we have to make assessments about if those two happen within 30 days of one another, if there could be a possible link. And so we're looking at that data all the time. And everyone in the world's doing the exact same thing as us. And so we have a lot of data there to inform us. So I don't think people should be too worried that this is a rush strategy. Actually, we have a lot of information that we can deal with. And the middle bit I've forgotten, so you're going to have to remind me.
It was about the long-term effects of pregnancy and fertility.
Oh, yeah. So actually, someone else mentioned this in their question, that there haven't been studies in pregnancies. There's actually been studies for the Pfizer vaccine in pregnancy, and it was administered throughout the whole period of pregnancy. So in the first, second, and third trimester, we know that mothers and babies did better if they were vaccinated, and the babies didn't have any problems at the time of delivery. Okay, so we actually know from clinical studies that it's fine to use the Pfizer vaccine in pregnancy. Fertility-wise, doesn't affect your fertility at all. People in Portugal are very well vaccinated, and they are having babies like it's coming out of their ears, okay? And those babies look fine. There's nothing wrong with them. So it's not affecting your fertility, all right? And the other thing I'd just say is that there was some data that people were looking at around rats and it affecting ovaries, and actually that was a bit peculiar because the doses that they were using in rats were like well over 100 times the doses that were used in humans. So it's kind of not relevant for the doses that we're using in humans. So I just put two things: is look at the human data, don't look at rat data that doesn't apply to humans.
Right. Cool, thank you. Matire, if we have a bad reaction to the flu injection, will it be the same to the COVID jab?
No. The COVID jab is quite different to any other vaccine that we have in New Zealand. It doesn't have the same products. As Anthony said, it doesn't have viral products in it. So it's pretty rare to see any serious effects. Nikki Turner, who looks after all vaccines across New Zealand, made the comment that she thinks less than 100 people will have a reason where they can't have the COVID vaccine. That's how rare serious side effects are with this. But having said that, if you are concerned at all, talk to your doctor, because a lot of the hospitals now have clinics where you can go and have the vaccine if you are concerned, and you'll be more carefully monitored to make sure that things are safe and that you're well looked after. So concerns, talk to your doctor, ask if you can have the vaccine at one of these clinics.
Awesome. Thanks, Matire. Jamie Lee, why do you get tired and achy after a jab? Like my arm felt like I was dead for a couple of days.
Yeah. And so Anthony touched on this before around what's in the actual vaccine itself and kind of how long it stays in our body for. So the most common side effects people will get is, like you say, pain right around the site of the injection. Sometimes you can feel like you're having a flu, and in Anthony's case, he had morning sickness. So there's a range of kind of symptoms. And a lot of those symptoms like fever, runny nose, and other things like fatigue or being really tired are kind of what we expect from our normal immunity. So our immune system really. So it's our immune system recognizing the vaccine and creating those antibodies that we need for that protection. So that pretty much summarizes why you get those symptoms.
Cool. Thanks, Jamie Lee. We're back to you, Anthony. You get all the good ones. I'd like more information on the adverse reactions. I've been following the reports from MedSafe every week. It says that there are 60+ deaths. Why is no one reporting on them? Who is liable for a death or any adverse reactions to having the vaccine?
So there haven't been 60 deaths related to the COVID vaccine. There is one death that is associated with the COVID vaccine where the vaccine was linked to the outcome. What I was saying before is we have to report a death that occurs within 30 days of having a vaccine. Then special groups, the Independent Safety Monitoring Board, CALM here in New Zealand, make an assessment if the vaccine caused the outcome. So it could be something like, I have cancer, I died of cancer, but because I had my vaccine in 30 days, they are mandated to see if there's any association. So when you look at the CALM website, they are looking at the unfiltered data of things that are under assessment, not things that are caused by the vaccine. So it's really important to sort of distinguish those two things.
Cool. Thanks, Anthony.
And around liability,
yes.
You are in New Zealand, you're protected from any medical outcome under the ACC Act. So that's how we protect all of ourselves against having sort of medical misadventures. So we're not like the US or even Australia, actually, where people sort of take out lawsuits or are required to take out lawsuits. You're protected, and that's a good thing. We must always remember that it's better to be protected by a system that looks out for your well-being rather than someone being left out of the system, so to speak.
That's good to know. Our next section is around tamariki, children, and hapu mama, pregnant women. And Matire, why are children under 12 not being vaccinated yet? And do you think that that will change anytime soon?
Yeah, so we're not vaccinating under 12s because we probably don't have enough information to do that at the moment. There are some critical questions being asked in this space though. So the first is, do they need it? Some suggest that the transmission of infection between children is not as great as it is with adults. I'd argue though that in New Zealand we've got, you know, multi-generational whānau living in one whare, and so I would be concerned about that, children potentially taking it back home and infecting people who might have chronic disease and putting them at risk of severe COVID. I think the second question that we were asking is it safe for our children? And the evidence so far suggests that it probably is. As Anthony's touched on, we've been monitoring the side effects, and you've got to weigh those up, like the heart inflammation with the vaccine versus the fact that it's 30 times more common with COVID. And the fact that it's the vaccine inflammation of the heart's very mild, and it's something that we can manage at home. So that's the second question. And then the third question is, do they need 2 shots? Is the big thing that they're working on at the moment. And the evidence suggests that probably not. That with the 5 to 12-year-olds, they probably only just need the 1 shot to keep them protected until we look at those boosters in the future. In terms of, do I think this will change? I think it will. I think we'll have some more guidance around this before Christmas. Especially with the schools and things opening up and teachers being mandated for their vaccination. But in the meantime, the best thing we can do to protect our children is to be vaccinated. Our teachers, our caregivers, our health workers who are working with children need to be vaccinated to ensure that they are kept safe.
Well, yeah, that's super interesting that that's all developing quite quickly, isn't it? Jamie Lee, what is we've sort of touched on this a little bit, but what is the evidence of vaccine side effects amongst Hapu, pregnant and breastfeeding mothers?
So the real, I mean, in general, being Hapu and doing anything to yourself like a vaccine is scary. So the main point of, I suppose, concern for both of those issues, so whether you're breastfeeding or whether you're Hapu, is the concern about whether the vaccine gets into baby when you get it, and the other one being, does the vaccine get into the milk? And the first thing to say about studies, and Anthony discussed this already, but millions of pregnant women have been followed after having their vaccination during pregnancy, and there's been no increased risk of early delivery or preterm delivery, no increased risk of stillbirth, and no increased risk of miscarriage, which are obviously the first things on your mind. So that's really reassuring. So in summary there, the vaccine doesn't get into baby via the placenta. And we actually kind of know that already, even prior to COVID, we know what can cross the placenta. So the placenta is like a protective barrier that feeds baby. So there's only certain things that can cross from you, the mum, to baby. And the components in the vaccine, the main one being the mRNA, cannot. And we've known that prior to COVID. And the same goes for breast milk. There have been studies done, obviously, very ethically, of course, looking at what's in the breast milk, because the concern is there mRNA in there, and millions of patients have been looked at, and that's not the case. So the reassurance for obviously something like this, which is scary as a mama, is that you don't have to worry about the vaccine getting into baba, and you don't have to worry about it being in the milk. But the other thing that's really cool about breastfeeding baba after you've been vaccinated or as you've been vaccinated is that you create a protective barrier for yourself. And those antibodies, which are the protective soldiers, can actually pass into baby. And we've found that those antibodies are in the milk. So it's a double kind of privilege there for you and Bubs.
Oh, thanks, Jamie Lee. It's really good to know. We're moving into a section about fears and worries and concerns that people have. And we'll start with you, Ants. How do we trust, just right on there with a great one, how do we trust today's science when tomorrow it can be proven wrong? We were told the vaccine would stop us getting the virus. However, now it just lessens the chances. Will this be again downgraded in the future?
I think that's the nature of science, and we talked about this earlier, as we measured lots of different outcomes here, and as the virus evolves, science needs to evolve to meet that demand, and that will happen with the vaccine too, as we want to create vaccines that are better than the ones that we have today. But we shouldn't forget that the vaccine is still very effective at making sure that you stay well and that you don't end up in hospital. Okay, it may not be as effective as we hope for transmission, but it's not zero. You know, it's not like being not vaccinated. I think we've got to look at the flip side. Is if you look at the unvaccinated population, we've just talked about all the statistics now. Vaccinated people do better for all outcomes. Unvaccinated people do not do well for the outcomes. So it's pretty clear that the data's in people and people are doing better that are vaccinated. And that's the science and that's the evidence. Do we want to be better with our next vaccine? Hell yeah, I want a better vaccine, and I want a vaccine that does all those things and more. But don't ever get worried that science evolves. That's what you want science to do. You don't want science to be anchored in the past and not evolve.
Yeah. I think that's an important point. Matire, how do we deal with underlying health issues for club members, I think this is referring to. So how do we deal with underlying health issues for club members that are afraid to be vaccinated and club members that choose not to be vaccinated?
Yeah, I think that's a really good question, because there will be people who don't want the vaccine. So for those whānau, it's critical that they make a plan. You need to make a whānau plan to help prepare the whānau for when COVID comes into your whare. So you need to think about things like getting organised in terms of having all the emergency numbers available if you need to get hold of the doctors or the ambulance or pharmacy for your medications really quickly. Have essential items in the home, so have a first aid kit, make sure you've got water and all of those, you know, enough kai, enough toilet paper, all of those things in the whare. Think about things like childcare for that person, because if they do get COVID, they may have to go into a managed isolation facility for at least 2 weeks. And for people who become very unwell, we're hearing of people in hospital here in Aotearoa, 40 days and more. So you've got to think about the fact that you might have this person away from the home. So planning for that as well. And then getting them in the best shape, I guess, would be the final thing, is so making sure that they've got any health condition well managed, so that their diabetes is at the best that it should be. They've got all their asthma or lung conditions well managed with medication. They've seen their GP. They're up to date with medications and blood tests, and you know, people are keeping a close eye on things. So keeping them safe and just being there for them to keep encouraging them around the vaccine. So that hopefully they might change their mind.
Thanks, Matire. Jamie Lee, what if I'm scared to get the vaccine? I'm scared it might hurt me, or I'm scared that I might be one of the unlucky ones that dies because of the vaccine.
Yeah, I think fear's been a real integral part of this whole rollout, really. Anything new is scary, particularly in medicine. So I guess, you know, there's no real quick fix answer for that. It's okay to be scared. Even as the science evolves, the messaging is evolving. So we're getting so much messaging from our formal, our governance leaders, but then also we're privy to messages everywhere in social media. So that's only going to compound that fear. The best thing I can say is go to somebody you trust, you know, that won't judge you, and talk it out. The other thing is, you know, you might find you could really conquer your fear in that. And I know that Matire's got a beautiful story about that, but I won't rugby past you. But I know that if I can share Matire, is that okay? You know, that she was really scared to get the vaccine, and she conquered that fear. So it's okay to be scared is I think the real message there. Yeah.
Awesome. Thank you. Anthony, you get the longer ones. So I'll start at the beginning.
I feel this is a stitch up.
Yeah, I think Matire and Jamie Lee might have sorted these, and yeah, the paddlers ganged up on you a little bit. We'll get you in the Waka though one day. I worry about instilling fear factor in everyone. Adults get sick and die, kids get sick and get over it. If you are compromised, you would be careful. If you are double jabbed, why is everyone so worried about catching it? Life is risky, Waka Ama is risky, driving a car is risky. So why are we so worried about this?
So yeah, life is risky, but you wear a seatbelt in a car. You take precautions so you don't drown when you're on a waka, and vaccination is no different. This is another thing to help protect people, and that's just the simple answer. We assess risk, and then we do everything to mitigate that risk to protect ourselves. Vaccine is part of that strategy.
Great, thank you. Matire, there's a lot of talk about the misinformation online from anti-vax professionals, but we must acknowledge the misinformation we receive in general through mainstream media here also. Do you think the vaccine debate media strategy has created unnecessary tension amongst our communities? There seems to be a lot of hate towards the non-vaccinated. What do you think about that?
I agree. I think it's not good to create tensions and to pit one group against another. I think that's really unhelpful. I've seen some awful stories going around, and even around COVID. Just this week we had Harry Tan being accused of travelling through Auckland with a sex worker into Northland, and it starts off as a Facebook post, gets picked up by a politician, next minute it's all in the media as if it's truth. So, you know, understand that this is an interesting time, and I think we'll look back to this time when we're doing history lessons and think, God, social media and the blocking that can happen over social media is just as contagious as the virus was, and was just unhelpful to our well-being as COVID has been. So it's unacceptable. What can I say in terms of addressing it is to if you are reading something and it doesn't feel right, get more information, but make sure it's really good quality information. You can't trust social media posts. I would say talk to people who are mana enhancing rather than mana diminishing, and who are going to put you down for your views on anything. Find people who you trust. Don't get into debates on social media, because you'll just get down some big fat rabbit hole and get all twisted, and I don't think that's very good for your own well-being as well. And one thing that I've been trying to practice is getting off social media after dinner, because I think if you get into it at night time, it does play on your mind overnight, and you know, I think try and keep away from it and focus on your own whānau in the evenings.
Awesome, thanks Matire. Jamie Lee, do you know of any support for those people who don't want to have the vaccine?
Yeah, I think, you know, the same messaging Matire just said, I total everything she's just said. I think the point that I'll make with those who aren't wanting to get vaccinated is there are a range of reasons why people don't want to be vaccinated, and it's really easy to assume they're all anti-vaxxers and they're all on that side, you know, where we start pitting against each other, and as Matire said, it is just hoha. It's not going to help anybody. And there's also that group in the middle who could be swayed either way, and so with such a I suppose, negative and angry discussion and rhetoric going on, it's not actually going to help them move either way. They're probably just going to stay there and go, well, either side doesn't look like they're behaving well. I'm going to stay here. You know, that's an actual response, and it's a legitimate one in that context if they're being exposed to that energy. But yeah, I think the same points as Matire has made. The support groups, I mean, I wouldn't probably go to websites that make you feel emotionally unstable. So reading things that are emotive, I think that it's really good to stick to things that are factual and don't have emotions tied with it. It just helps you kind of get clarity. But again, it's where are those sources? And at the end of it, I think we'll talk about resources, but we'll put together a list of really good, what we think are pretty good resources, and not just your generic websites, but also some Instagram people that even I use, so that who are doctors as well and are running off the evidence. So they're completely looking at new studies that are coming out and are producing really bite-sized pieces of information. So I think those sorts of things help us just to kind of sit back and go, okay, that's the evidence, and I can make my decision, and do it with people that you trust and that have your back.
Kia ora, thanks, Jamie Lee. Back to you, Ants. Do you consider it discrimination and a breach of privacy to ask for evidence of being vaccinated?
No, I have to provide my license when I drive my car. I have to provide my passport when I cross borders. The requirements that are put on us for showing evidence for something are determined by whether or not that's required. At the moment, we have asked people to be vaccinated in certain areas to ensure protection for both themselves and others. So when it comes from a place of protection, we can't skew that into being discriminatory. We've got to really be clear that this is because we want to ensure protection. So I know for those people that are not yet vaccinated, that it feels like discrimination, but it shouldn't be. We shouldn't use it to discriminate people. We should use it as a pathway to discuss about why you haven't yet been vaccinated, what can we do to support you, what things would you need? Can we govern what restaurants will do? Can we govern what other workplaces will do? Not everything can be regulated in that regard. So I go back to what Jamie Lee just said, is we can't be using this sort of divisiveness in society to separate the vaccinated and the unvaccinated. And I just looked in the chat as well that, you know, if the government has money to feed the public, why is it only giving it to vaccinated people? No, food should be provided to anyone who needs it. So we don't need to enmesh things to create disharmony in society. What we have to do is understand why we're doing these things. Mandates are just like incentives or disincentives. They're kind of promoting people to do something, but they're not enhancing the decision-making process. They're actually demeaning it by saying, I'm sick of explaining this to you. You're just going to do it. Okay, so it's like having an argument with someone where you just give up. You stop listening, you don't care, so you just make a decision. So no, I don't think it's discriminatory. Do I think it's effective? The jury's out. It probably does shift some people to do things because they feel like I just have to do it. But do I think on an ethical, moral debating scale, it's the right way to approach it? Probably not.
Kia ora, thank you for that. The next couple of questions are all for you, Ants, around alternative vaccines. And we're getting there. We're getting to down to the end. So we're doing well. Thanks everybody. The release of can you provide more information about the release or possible release of the Novavax vaccine immediate, so that so those resistant to an mRNA vaccine can be vaccinated with a more traditional type of vaccine?
So when Matire was part of this discussion, they actually made sure they chose 4 different vaccines. They chose different vaccine technologies to ensure that we had access to more than one thing. what ended up happening is we went with Pfizer because it was so good. But you're quite right. There probably are some people that are saying, well, I'll have a vaccine, but I want the vaccine that I know I've had other vaccines of a similar type and I feel comfortable with. That's a fine decision. The difficulty at the moment is Novavax is just that little bit further off. And so we're probably not going to get a delivery of Novavax maybe to early part of next year. We're really fighting hard to get that earlier just because we'd like to see those people who want an alternative vaccinated early. AstraZeneca and the Johnson & Johnson vaccine are having a bit of trouble at the moment. The AstraZeneca vaccine, you know, they did such good studies, but probably you got to commend them on doing such a great job, but it's probably not the vaccine that we're going to go for just now. And the Johnson & Johnson vaccine, although it looked like one dose was okay, now they're having to use their stock to give another dose because it probably looks better if you give a 2-dose. So those 2 vaccines pose a problem for us because we, just like this person that answered the question, are waiting for Novavax as well. So if there's a specific reason why you want to wait for Novavax, definitely talk to your GP, talk through why that is, because it may be something that we can still talk about and reassure you that an mRNA vaccine is still good for you as well.
Yeah, cool. I think that kind of leads on to this next question, which is, what is the alternative vaccine to Pfizer for people wanting to be fully immunized and have had adverse effects from the Pfizer dose 1 and want to have a different one for the dose 2?
So in my mind, there's really only one situation at the moment that I say you're going to have to wait for a different one, and that's the myocarditis, because that is Pfizer specific, and we would use a different vaccine. There's just no way around it. There are people that have allergic reactions to the vaccine, and there's good data coming out now that even if you have an allergic reactions to a component or the vaccine, that we can actually protect you by treating you to get that second dose in. So at our clinic at Auckland Hospital that Matire was referring to, we give people the second vaccine in an observed setting and we treat them with antihistamines. And to date, people that had like full-blown allergic reactions, so we call that anaphylaxis, they drop their blood pressure, they get really sick. 26 people have had their second dose without any problems. And that's just in our single clinic. Overseas, at the Massachusetts General Flash Clinic, in America, they saw the exact same thing. So there's a lot of data now showing that we can probably get you through everything, bar the myocarditis, where I think you should wait for a second alternative vaccine.
Okay, great information to know. Jamie Lee, beside the worst effect of death by COVID, what are some of the worst long-term symptoms most commonly reported by survivors of the COVID infection?
Yeah, so there's a long list, and probably the most common symptoms that have been reported are things like fatigue, insomnia. Some people have been reporting palpitations where your heart sort of flutters away there, and there's a headache. There's a whole list of kind of things that we might presume could be something we all go through, but that have been monitored in those patients who've had COVID, and that have come up more often. So yes, there is a long list of sort of symptoms, but those would probably be at the top of the list of what's most likely to happen in those who have long COVID.
Right, not something that you want to have.
No, not at all.
No. Ants, why is there no medical treatment like ivermectin and azithromycin being offered to patients who are in hospital with COVID-19?
So I'm so glad we practiced our words before we went on here. You did so well. So the first thing I would say is we do have treatments for people that get COVID here in New Zealand. We have dexamethasone, we have tocilizumab, and now we have another antiviral drug that was just approved by Pharmac this week for the treatment of COVID. The reason we don't have ivermectin and azithromycin to use for COVID, we do have them to use for diseases that they treat, is because they don't work. That's the end of that question, is no matter which data set you've looked at, no matter which country that you look at, ivermectin and azithromycin are not designed to work for COVID, and they don't work. So use the other 3 treatments that we have because they do work for COVID.
Kia ora for that, thank you. This next few questions is about supporting whānau, and Jamie Lee, what is a strategy that we can use to encourage our rangatahi to get vaccinated?
So obviously those strategies are still in progress as we try to rally our rangatahi through. But one of the things that I noted from a rangatahi webinar only last night, actually, that my husband was a part of, was, you know, there's a big kind of a position on just the opportunity to have a choice to do something or not. You know, it's our choice. You hear kind of a lot. And I think it also comes down to the polarizing information that they're being exposed to. Especially on TikTok, there's actually some pretty out there TikTokers and on Insta as well. So they're accessing that on the daily. The other thing they made a comment about, which I agree with actually, is that new marketing towards the rangatahi, the shot bro, get the shot. You know, they found that corny. I found that corny. Sorry to the people that, well, actually not sorry to those who actually consulted on that. I kind of felt like that's not one, our rangatahi aren't grouped into one general way of being, and we don't all go shot bro or shot cuz. And there's nothing wrong with that either. But I think the message was received as, oh, that's a bit cringe. So I think we need rangatahi making rangatahi-led solutions. If you want to target certain people, you go to the people and you wānanga with them. And that's what I'm seeing with all these webinars. So as soon as we see those numbers climb, then we'll know what strategies are working.
Awesome. Thanks, Jamie Lee. I think Matire directed that to you because you may be the youngest one on this panel. Kia ora. Matire, you've had a little bit of a break for the last few questions, so we're back to you now. What are some proven and innovative strategies to engage our people and get them on board with the vaccination?
So I think Jamie Lee will provide some information to go on either the Waka Ama website or Facebook page around this, because there are lots of strategies that do appear to work and that we've been using for years and years, because we've had the same conversations with childhood immunisations and have managed to get 95% of Aotearoa vaccinated in that space. So we will use some of that. But I just want to touch on 3 things, I think, that that I've been using in my practice. So one is listening. And I think that's the clear thing, is that I always ask, so I normalise it in my conversation, have you had the vaccination? And then I listen to them and I don't judge them, and I'm not going to push anything on them. And so when they might say to me no and explain why, would you like to talk about that now? Again, not loading information on them, letting them decide when they want to hear that information. If they don't, I'm here. If any time you want to have a further talk about this, I'm here to tautoko you and to support you finding out more information. So that would be the first strategy, is making sure that you normalise it in the conversation and that you're listening and not letting people know that you're always there for them to come to. The second thing is that we do talk a lot about our values. And I think here in Aotearoa, we have some real beautiful values that are kaupapa Māori values. So things like whānau, which is, I think, inherent in Waka Ama, is the whanaungatanga that we have. The sport goes from our pepe right through to our kaumātua. And so thinking around that collective responsibility, I think Anthony said it's not herd immunity, it's collective immunity is what we're aiming for. And so thinking, if I'm not going to do it for myself, can I be doing it for the people that I love, the people that I want to be with, the people I want to protect and keep safe? So that would be the other thing, is, you know, looking at what values are important to the people that you're wanting to encourage to get vaccinated. I think in Waka Ama too, you've got to think about those long-term impacts of the COVID. If you want to participate at a high level of sport, you don't want to be having heart palpitations and breathlessness for years and years and years and not being able to paddle. You want to be able to go and travel around the Pacific and paddle with our Pacific brothers and sisters in this Indigenous Pacific sport. And so those things too should encourage people. So look to those things that are going to be important to the people that you're talking with. And then the third thing that I've used in my own personal experience, and Jamie Lee was just talking about it. So I took my 15-year-old to get his vaccine, and I put everything in his, this is your decision. Do you want to be vaccinated? Yes, I did. So then we provided a range of options. We've got the airport with your Auntie Summer, who's doing it there. No, actually, Mum, I want to come down to the marae where you work. I want to have it in my community with everybody I know and who I know is going to look after me. So we did that. And then when we're talking about incentives and rewards, I'm not sure that works either, but we wanted to celebrate this because he was the last person in our whānau to get vaccinated. So we said to him, what should we do for dinner tonight? Oh, KFC chicken wings, which is totally unhealthy, I'm sorry. So I hope there's no nutritionists on this hui tonight, but rather than using it as a reward, this was a chance for us to celebrate as a whānau. Okay, we'll do that. We'll go home, sit and relax so that you're recovering from the vaccine in a safe space. We can keep an eye on you, but you're celebrating with something that you like to eat and that you enjoy doing as a whānau. So looking at opportunities to show aroha and show how you can be proud of each other as you're going through this really important step, but equally, as we've said, can be very anxiety driven as well.
Oh, that's a great story. Thanks, Matire. Yeah, that's awesome. Jamie Lee, how do I help my older whānau members trust the vaccination process when they've been continually let down and unsupported by Dhbs and Western health models in the past?
The first thing I'm going to say to that is I absolutely agree with that statement. One of the things, I know we all collectively do in this rōpū here, but one of the things that's kept me in the hospital is because I understand the barriers of not only just accessing hospital care, but actually being escalated when you need more care. Okay, and then the worry with us being hospitalized as a people is we know from decades of studies that we get things less often. When we do get them, we experience them worse than most other people. So the thing I worry about is who are they going to escalate to ICU when it comes down to determining or picking among a lot of us that may need ICU care. So it's really easy when you put that hat on to go, okay, this is what the data shows us. So you should just get vaccinated and just get it done so you don't have to come to hospital, and then we have to navigate that often very treacherous and institutionally racist system. So I think that I totally align with that, and I agree that our system has a lot of work to do with building trust between specifically Māori and Pacific communities, but also pots of different parts of the community. So again, taking that hat off with all the data and the hard facts is it's really hard to pull back and just listen. And as Matire said, show aroha for that. Understand that it's another traumatization to now have to confront another part of the system because you're being told to do it by people that you probably won't ever trust. So it's really important. But I do want to say that the rates of vaccination among our korauā kuia are amazing. We're doing really well there, so I want to mihi to them. But we do have to be mindful that the youngest Māori who have passed away from COVID were in their 50s. So we celebrate that, but we also want to celebrate all of our whānau getting through that vaccination process so that they don't have to re-navigate a system that can be untrustworthy.
Yeah, super. Yeah, that's lots of great advice there, Jamie Lee. Thank you. I think we've had something like 40 something questions so far, and we've sort of come to the end of our medical questions. Not to say that our doctors can't jump in here at any time, but the next lot of questions that we received were all about the Waka Ama specific and events and what's happening and will nationals go ahead. I'm just going to try and summarize all the questions in one long question, which is basically, is nationals happening? Is the world sprints happening? Will I have to be vaccinated to come to nationals in January? What about our Thai tamariki? Will they need to be vaccinated to come to nationals? All of those things are, for us, for Waka Ama New Zealand, we are receiving information from government. It's changing daily, weekly, very quickly. Just like all other sports, we're all, especially summer sports that are just starting our season and gearing up, we're trying to navigate this space and do what's best for all of our whānau within our Waka Ama community. And whilst the racing and the competition part of our sport is really important to us, Jamie Lee and Matire will know, as well as all of the people listening, that our sport of Waka Ama is more than a sport. It's a way of life. And so I know that the board of Waka Ama New Zealand are very mindful about looking after our whānau and our Waka Ama community off the water as much as we are on the water, which is why we are doing things like this tonight, to try to help provide people with information that will help to inform their decisions and moving forward. So, with things like the nationals coming up in January, whether or not the government mandates for large scale events to be vaccinated, we don't know that yet, but we are planning for whatever scenario comes up. And I think from what we've heard tonight and some other advice is that just like we're planning for however our events might look, it's good for people to plan for what that might look like for you as an individual as well. So I think what Matire said about protecting not only yourself but those people around you, and making decisions that are collective decisions to protect the collective group of Waka Ama individuals is something definitely to be considered. So I'm not sure if you have any comments, Matire, about Waka Ama events coming up over the summer.
A few of us in Auckland were saying, because we haven't been able to get out and paddle, we'd probably get wasted by all the level 2 clubs. Anyway, so that's just me being completely selfish, I guess. I think you're right, Lara. I think the government is heading to more mandates around some of these larger events. We've already seen it around some of the concerts. Rhythm and Vines are talking about it, and that's certainly motivated some people to go and get vaccinated. And so I do expect that we may have to see that, and particularly in a sport like Waka, which, as I said, ranges from our tamariki right through to kaumātua, and the range of the potential for people to be living with long-term conditions which will impact on their ability to be able to fight COVID should they get the infection. Anthony might have some more information on that particular question.
No, I think the reason that every day it changes the advice is because this is kind of an evolving situation at the moment. And, I think we just need to see what happens next week in a month's time, and then we'll be able to make decisions. It is difficult, and I get that, but if we make a decision now and then disappoint you in a month's time, that's a worse thing than saying we can't actually know what's going to happen. And almost certainly we will see cases rise, and we'll have different strategies to combat that, of which vaccination is part of that. And that's going to be a big mind shift for us. We've lived in an elimination strategy for so long. As we see that change, it's very nerve-wracking. It's nerve-wracking for medical specialists. It's nerve-wracking for the community. We understand that, but we will transition into a different model. And actually how that affects Waka Ama is what we will find out in terms of, but we just need to be patient, wait and see, and we'll get through this. we'll get through it, and you'll be able to be together soon. And Matire can practice a bit more. I'll practice my Waka Ama jokes that I didn't get to use tonight, and we'll all share it in a big group together. But we'll get there.
Yeah, I agree. Thanks. And I think, you know, for us, like you say, it's evolving so quickly, and you know, we just want to stay informed with the best information that we can have. You know, we're fortunate that Sport New Zealand are you know, helping to guide sports through this, and you know, other sports are all talking to each other, so we're not all in this alone in terms of events and how we're progressing with competition. But first and foremost for us, it's about the people, and not necessarily about the competition. Although I did just see a question come in, which was when can we expect to see Anthony in a waka? He's gone silent.
Not until I get to use my Waka Ama jokes, and then that can be my punishment.
We'll have to have another hui for you to use your Waka Ama jokes, Anthony. I think that's it might pretty much be us. I know that Jamie Lee, you mentioned that you're going to provide some information for us to share on our website, where whānau can get more and more information and follow up with any questions that they have, or quality stats and info. Anything else you want to say about that?
No, you said it all. I think that, like I said, we just wanted to provide a range of stuff for people to access in different ways, because it's sometimes hard to navigate the websites. There's so many tabs. So there's some really important kaupapa that have been shared by colleagues of ours through their Instagram profiles, which I use, to be honest, with the evolving situations.
Cool. And maybe the three of you doctors might be able to put together a TikTok at some point. We'll see. Jamie Lee I'll leave that one for you to get going. But I think thanks everybody. I really appreciate the time that you've given tonight. I know that you're super busy, and you know, it was just last week that I texted Matire and said, hey, do you think we could do this? And she replied and said, yeah, let's do it straight away. And then got her mates, and Jamie Lee and Anthony came on board straight away. And you know, for people that are so busy and at the coalface of what's going on, you know, giving up your time to spend with us and helping our Waka Ama Whānau and all the other people that have been here tonight, we can't thank you enough. So ngā mihi nui kia koutou. Jamie Lee, would you be happy to close our hui with a karakia tonight? Thank you.
Tēnā koe, Lara. Tēnā tātou te whānau Waka Ama, me te hapori hoki. Kia koutou ngā kaiwhakahaere o Waka Ama NZ, tēnei te mihi nui kia koutou. He kaupapa tino whakahirahira tēnei. Koenei te take kei konei mātou, ko ngā rata. I'll keep it really short. I just wanted to send my aroha out to everybody out there, and thank Lara and the team for putting this together, and also to thank the beautiful tōtara Matire and Anthony for you know, for just being amazing. And yes, I actually delegated the questions, so aroha mai. So you know, me karakia tātou. Hikitia, hikitia, hikitia. Te rongo mai whiti o tēnei hui, tukua kia ea, tukua kia oi. Ko rangi nui ki runga, ko papatua nuku ki raro. Tuturu e whakamaua kia tīna, tīna. Haumi e, hui e, tāi ki e.
Kia ora, thank you. Awesome, thanks everybody. We'll be sharing, we videoed this session, so we'll be sharing it online with everybody, and you feel free to share it with all of your whānau and anybody that it might be helpful to. Yay. Great stuff. Ka kite, thank you. Oh, I feel like we have to go for a paddle just with us lot.
At Molokai, no, Lily or Kona.
Anywhere. Yeah, Lily or Kalani, that would be good. Yeah.
Yeah.
That would be awesome.